Hello, psychology students. Professor Zeeb here, and welcome to another short video lecture. This time we're going to discuss a really fascinating disorder, one that gets a lot of attention in the media, for example. So it's an interesting one and a really rare and unusual one at the same time. So the disorder we're going to talk about this time is known as dissociative identity disorder. Some people know this one as multiple personality disorder. So it's basically the same thing, but the DSM describes it as DID, if you would. And so this is a particular disorder often connected to trauma where the person may adopt as many as 100 new identities. And we call those alters. In other words, each of them are a separate alter, if you would, almost similar to a personality. However, our average is probably closer to 15, but there are some cases where as many as 100 have been revealed. What's interesting about this one is that it's usually the host personality who seeks treatment, not the original personality of the person. So it shows that they do have these different alters that can switch, as we would say, and often have different demeanors and ways of speaking, for example, and we'll get into that in a few minutes. So let's get into our clinical description of this one. So with DID, the aspects of the person's identity are dissociated, meaning there's some type of disruption of identity by two or more distinct personality states. For example, one may be overly sexual, they may be actually different genders and have different ways of speaking, for example. Some of them incorporate different body postures and expressions, including eye movements. And in some cases, their physical capabilities may actually change. For example, their handedness. If they're right-handed, the alter may be left-handed, for example. So the point is that to diagnose DID, we would have to demonstrate some aspect of the person's identity has become dissociated, excuse me, and then they would also show amnesia. So this is very similar to dissociative amnesia, as we talked about it before, where there may be trouble remembering or gaps in their memory, in recollection of everyday events, for example. So sometimes they report these blackout periods where they cannot remember. And remember, we're saying this is outside of things like substance abuse. It's not that they're drinking, they've blacked out, for example. Uh, so they're having trouble remembering certain things. It could be related to the traumatic event. And these lapses are thought to be outside of normal forgetting. So once again, surrounding around amnesia. Okay, so let's take a look at our statistics. It turns out it's extremely rare. However, our female to male ratio is thought to be 9-to-1, and that's based on case study data. So we see a lot more female cases that are diagnosed compared to males. The onset is typically in childhood, almost always in childhood. It can actually happen as early as 4 years of age and usually rare after age 9. So usually we see it in terms of the onset in childhood. This is one of those disorders that can actually last a lifetime without treatment in most cases. So in other words, it's showing that it's very chronic in most cases. And what's interesting, looking at the long-term data and research with this one, so we mentioned how the person may switch alters, right? So some studies show the frequency of switching actually decreases with age. So according to that research, so I thought that was interesting. So as I mentioned, it's extremely rare. It's thought to be about 1.5% in the past year. This one's difficult to determine because it's such a rare disorder. So our author points out that it's really difficult trying to determine the actual prevalence of this one. But according to research, it's thought to be about 1.5%. And then research also reveals that they're often diagnosed with other disorders. So for example, they may also be diagnosed with anxiety or substance abuse. They may show suicidal tendencies, for example. And so there is some evidence that some of them are also diagnosed with borderline personality disorder, which, just to kind of speak to that real quick, this is where they may be a little bit self-destructive or show suicidal tendencies and are thought to be emotionally unstable. So sometimes they have a dual diagnosis. There's also research showing that they may hear auditory hallucinations. So in other words, they may also be diagnosed with a psychotic disorder, for example, schizophrenia, where we know with schizophrenia sometimes they have auditory hallucinations where they hear voices and they think someone's trying to communicate with them. The difference here is that often the person with DID knows that these are hallucinations. They know that these voices are coming from inside their own head and not an external source, for example. And they may actually try to suppress them, and they actually realize that they are, in fact, hallucinations. It does occur in a variety of cultures. So, according to research, at least 21 other countries have demonstrated the prevalence of DID. So, we see it globally, basically, in other countries. However, the explanation may be very different. Uh, for example, if they're not using more of a Western approach to diagnose problems, it may be labeled that they are possessed by demons because it seems almost like they become a different person, like they've been possessed or something. So we do see some cultural variety to this one, and how they explain it may be a little bit different, but it's also showing that this may be, may expand beyond Western type cultures, if you would. This one is also very controversial because there's some evidence showing that it may be influenced by suggestions by therapists. So, for example, one of the most famous cases of DID revolves around this book called Sybil. It's actually a movie as well, which is very fascinating and basically created a lot of buzz surrounding this disorder. I'm really going to recommend reading that book, Sybil. It's a really interesting book, a lot of psychology in it as well, which is why I like it. Some other movies would include The Three Faces of Eve. So there's a lot of media surrounding, the interest in this particular disorder. So it's a controversial one because there are some people that believe that because of this buzz created around the disorder, therapists started looking for it and maybe even suggested that to their clients, which ended up creating a diagnosis under false pretenses, if you would. So it's an interesting one either way, very controversial. But once again, the DSM does list this as a disorder. So hopefully you'll find it interesting as well. All right, so this will conclude our short lecture here. So please progress to the next step in the class.